Hi, everybody. Sorry, I'm a bit flustered. I really apologize for the mess up this evening of technology. I think there's only a couple of you who have been able to join because the link didn't work in Zoom and, the usual story. Anyway, I apologize. I'm not very good at technology. But for the few of you who are here tonight, and for the rest of you who I'm going to send this recording to, I hope that it helps. We're here to just chat a little bit about reflux and heartburn and what you can do at home for yourselves to try and manage this condition a little bit more and feel a bit more comfortable. Before I begin, I'm just going to try and, Before I begin, I do just want to make sure that all of you out there completely understand that everything I say tonight and everything I share with you tonight is for your personal interest and education only. I'm not diagnosing anything in any way, and I'm not replacing proper medical care in any way. If you have a disorder or if you are worried about something, if you have a lot of symptoms, please do go to your health professional, your doctor. You can come and see me in person, but everything that I say online is just for your interest, and you're welcome to double check all the facts I share with you. For those of you who are new tonight, I'm Ruth Hull. I trained as a homeopathic doctor. I also trained as a complementary therapist many years ago. And I'm also a writer. I write textbooks, health-related textbooks. I've done 2 on reflexology and 2 on anatomy, physiology, and pathology. I also teach anatomy and physiology, and I'm starting to do a lot of online education as well. So that's what you can look out for in 2022. So I do have a very good understanding of what I'm talking about. My master's degree in homeopathy was 5 years full-time. The first 3 years I trained in South Africa, so the first 3 years are very similar to medicine, and the remaining 2 years you look at nutrition, you look at lifestyle, you look at homeopathy, you look at herbs, and do a lot of clinical practice. And then after that you have 2 years in which to write a master's thesis. I did my thesis on remedies related to trauma care. So that's my special interest, is working with people with chronic fatigue, burnout, insomnia, and who have been through trauma. So let's talk about the more important stuff, the stuff you're interested in. I'm just going to move this little thing out the way so I don't have to look at myself. Okay, what is reflux? If you are with me tonight, or if you're watching this tomorrow morning, I think it's because you probably have a lot of these symptoms. You probably have that horrible burning sensation behind your chest, behind your sternum here. Maybe some people describe it as burping up food. Some people even say they feel like they've got vomit in the back of their mouth. Not a very nice description. Some people actually don't know they have reflux, and instead they just have a chronic cough, this little cough that is quite a dry cough, like a often worse at night, worse when they're lying down, or worse first thing in the morning. And some people also go quite hoarse. Their voice tends to change a little bit. They may have pain on swallowing. There's a difference here between pain on swallowing and difficulty in swallowing. Difficulty in swallowing is something completely different. And you need to get that checked by your doctor. But just pain on swallowing, little cough, little hoarseness, these are all symptoms of reflux, and often worse when you're lying flat, when you early in the morning when you wake up, also if you bend down, or if you strain, so if you're lifting heavy things. And basically, I always think if people understand what's going on in their bodies in terms of anatomy and physiology, then they'll be able to make those small changes in their lifestyle that can improve their health. So if you just look at this image here, it's a little body, and you've got the stomach here, and this lovely red esophagus here. Basically, where these 2 arrows are is there's a muscle, it's a sphincter muscle, so it closes and opens like this. And It keeps the contents of the stomach inside the stomach. The contents of the stomach is very, very, very acidic to break down your food and also to kill any bugs that you may have consumed, you know, any bacteria or anything that you've eaten. So we need a very acidic stomach to digest our food properly and to prevent ourselves getting too many infections. However, sometimes this little sphincter muscle here tends to be a bit open. It doesn't keep closed properly, and the contents of the stomach actually come up into the esophagus. The esophagus is lined by a very different type of tissue, a very different type of cells to the stomach, and it's tender and it's sensitive. And that's why when you've got the stomach acid coming up the esophagus, you get a lot of pain, a lot of inflammation, and long term, you can get a lot of damage to the esophagus. And this is what reflux is that pain, that burning, all the contents of the stomach coming up. You don't want to leave this untreated. It's really, really important not to ignore reflux. It's very common in people, and I'm going to chat to you about how you can change your diet and what small changes you can make to manage it. But if reflux continues for too long, what happens is the lining of your esophagus actually gets damaged. It becomes scarred, and you can even put yourself at risk of getting a certain type of esophageal cancer. So really, if you have reflux, please get it sorted out. Make these changes at home that I'm going to share with you. I really do see big improvements in people if they make all these changes. Some people need more than just lifestyle changes. They need medication. You can go to your GP, or you can come to me as a homeopath. You can find a good naturopath. You've got a lot of options. Just please don't ignore your symptoms. Don't think they're nothing. The next slide. Okay, so yes, a little bit about homeopathy. I've just got to keep moving this thing. Homeopathy is it's a system of medicine. As I said earlier, there's a lot of training involved, and it can be used in conjunction with your mainstream medicine. So if you are on medication that is causing reflux, and on the next slide, I'm going to mention some of these, because a lot of your chronic medications that you need can have reflux as a side effect. So this is where homeopathy can help you, because it can help with the side effects of your chronic medication without interfering with them. It can also just help with reflux a lot. And if you come to me, we would really look at your diet as well. So let's look at what, have I missed the slides? Sorry. Yeah, no, okay. So tonight we're going to look at how you eat, what you eat, and when you eat, and how these really affect your reflux. And I've actually somehow lost a little slide. There we go. Okay, sorry about that. Talking about the medications that cause reflux and what causes reflux. I didn't want to miss a slide. I don't know what happened to it. It's one of those technology nights. Okay, so the main causes of reflux. First thing, when you have a health condition, the first thing you need to do is find out what is causing that health condition. And if you can, either get rid of the cause or control the cause. So I've got up here the most common causes of reflux. The first is, if you can see my little blue, what's it called, the cursor here. Sorry, I see someone's asking a question. I will answer all your questions at the end. It's a short presentation, and we'll have lots of time at the end to chat about questions. But yeah, the first cause of reflux, and it's really, really common, is if someone has a hiatus hernia. And this is common in people who are overweight, or who have strained themselves, you know, weightlifters who lift something too heavy, or workmen who lift something too heavy. It can develop in pregnancy. I'll talk a little bit more about pregnancy just now. But what you have is, this is the stomach. And this you can see it faintly here, this white sheet-like thing here is your diaphragm. And your diaphragm, and there is your little sphincter muscle, and your diaphragm helps keep the stomach sort of in the abdomen. And it helps maintain the pressure, intra-abdominal pressure, which helps your digestive system work. But sometimes, and there's not always a reason, sometimes it just happens, part of your stomach actually comes up out of up between the diaphragm. And so this is actually part of somebody's stomach here, and it's called a hiatal hernia or a hiatus hernia. So now what you have is you have all this hydrochloric acid and, you know, very, very acidic fluid sitting up here without a sphincter muscle to keep it down, without the the diaphragm to keep it in place, and it just goes up your esophagus. Another cause really common in reflux, and sorry to depress some of you out there, but coffee. Caffeine tends to really aggravate that. No one is sure why, but a lot of the theories is that it aggravates the sphincter muscle. Caffeine, chocolate, and alcohol, they are known to sort of adjust the tone of that sphincter muscle, so it just tends to stay open a little bit and the contents of the stomach come out. So if you have this is not my evening at all. If you have reflux, you really do need to cut down on your caffeine. And remember, caffeine is not just in coffee, it's in Coca-Cola, it's in some teas. Unfortunately, it's in chocolate. But yeah, you really need to cut down on caffeine, on chocolate, and on alcohol. The third major factor, the big cause in reflux, or if it's not causing your reflux, it may aggravate it, is medications. And there's a long list of medications that aggravate reflux. Some of them are quite surprising. So a lot of your antidepressants aggravate reflux. A lot of your osteoporosis medication, bisphosphonates, it's a type of medication to treat osteoporosis that aggravates reflux. Codeine does. Progesterone does, and some of your medication for high blood pressure as well. So what I find with a lot of my patients is that they come to me and they are on specific medication, and they've noticed since being on that medication that they get nausea or they get reflux. You don't want to stop a medication, especially if it's for something severe like heart disease or depression or osteoporosis. You don't want to just stop your medication because it's causing reflux. What you need to do is you need to manage your reflux through your diet and lifestyle, lessen the other aggravating factors, which we're going to talk about, but also chat to your doctor. There's often alternatives to the medication you're taking. So if you are getting reflux from your medication, talk to your GP about it, or talk to your pharmacist about it, and maybe they can either give you an alternative medication that does the same job, or they can change your dose. Or you can come to a homeopath to get a homeopathic remedy that will help with the side effects of the medication you're on. So don't stop your medication, but try and work with it a bit better. So those are the three main causes of reflux. Other causes, not necessarily, well, pregnancy is very common. In pregnancy, reflux is common because you have so much that fetus is taking up so much space in your abdomen that your stomach is just being squashed and pushed up, and it's not surprising that you get reflux. So it's common in pregnancy. If you're pregnant and you have reflux, homeopathy is great because it is very safe for the pregnant woman and the baby. It has no side effects. Also making the changes that I'm going to talk about in the next few slides to how you eat and when you eat will help. Unfortunately, reflux is common in old age. It's just one of those things, part of the process of aging. It's common in obesity, very common in obesity, for the same reasons that it's common in pregnancy, is that you have so much else taking up space in your abdominal cavity that there's just not, there's not a lot of room for that stomach, and you get a lot of pressure on the contents of the stomach. This little image here is actually of little fungi, and reflux is common in people who have systemic fungal infections, as well as so something like candida. If you have candida or thrush, don't be surprised if you have reflux as well. And in patients who have chronic autoimmune conditions or chronic low immunity, so maybe something, if I worked in South Africa, so I'm used to working with people who have HIV, so they have a very, very suppressed immune system, TB, also people with cancer, even people who are on immunomodulators for, say, rheumatoid arthritis, something like that, or lupus. Those, when your immune system is being suppressed, then it is quite common to get systemic infections, and this will aggravate or cause a reflux. So that is something that does need to be treated by a health professional. And the last image here is a rather sad one, but some people do actually try and drink bleach or some kind of caustic substance to try and kill themselves. And after that, they will have chronic reflux ongoing. So that is very difficult to manage. But things can be improved with really small changes to your lifestyle, which is what we'll talk about now. Okay, let's go ahead a bit. So what can you do at home? To help manage your reflux, just think of 3 things: how you eat, what you eat, and when you eat. I love this image. I use it quite a lot in a lot of my my talks, and I love the quote as well: eating soup with a fork, slow and messy. This is how we should eat. Unfortunately, most of us don't. We tend to just scoff everything down as quickly as possible, and we tend to eat as much food as possible. If you have reflux, you need to make sure you're chewing your food properly. Remember, digestion starts in your mouth. Chew your food properly. Make sure that it's really, really mashed up nicely before it gets to your stomach. Because if you have big chunks of food swallowed whole sitting in your stomach, you're not going to have a happy stomach. Also, in terms of reflux, eat smaller meals. Try not to eat huge meals, especially not at night. And I'm going to talk about that just now. But yeah, really focus on how you eat. Chew your food, eat small meals, and relax when you eat. Just enjoy your meal. Take some time and enjoy your meal, and let digestion just do its natural thing. And this food here looks great. It looks super nutritious, really, really healthy. But unfortunately, it's not good if you have reflux. If you have reflux, there's a lot of foods you have to avoid. And that's why a cookie in each hand, I'm not saying it's better, this is a joke, but it's horrible having reflux, because sometimes people come to me and they eat so well, they make such an effort with their diet, and they have terrible reflux. And they sometimes say, I may as well just be eating junk food because I still feel so terrible on a healthy diet. So what you need to avoid in terms of food is, firstly, all those cookies and the biscuits and the cakes and the breads and the pastas. And I think you probably know that already. If you have digestive problems, you probably have already, well, I hope you have really cut out all those obvious things. But with reflux, you need to refine it a little bit. So if your reflux is severe, then I recommend cutting out most grains to begin with. So in terms of starches, stick with your sweet potatoes and potatoes. Cut out pasta, bread, even rice. A lot of grains just aggravate your whole digestive system, to be honest. So look more, Google paleo diets, look more at paleo diets, primal diets. Those will help you with your reflux to begin with. But to get very, very specific, you need to, and this is horrible, but you will notice an improvement. You need to cut out tomatoes. So if you look at this picture, tomatoes, peppers, citrus fruit, except for lemons. Surprisingly, lemons are okay. They are not very, they buffer acidity in your body. So lemon is okay, but other citrus fruits. So it's tomatoes, peppers, citrus fruits, a lot of your spices. I think most people with reflux know that spices just aggravate it. So your chilies, your spices, cayenne pepper, all those kind of things. By peppers, I mean your bell peppers and your red and yellow and green peppers. And then what have I forgotten? Oh yes, so your tea and your coffee and your chocolate. And yeah, so cut those out. I've gone blank here and I don't have any notes. This is what happens when it's the end of the day and I haven't got notes. It's your tomatoes, your peppers, your citrus fruit, your spices, your grains, caffeine, alcohol, and chocolate. Okay, so that's 8 things that you should eliminate from your diet completely. And try that. Sorry, my dog's having a good old bark. Do that and trust me on this. Cut that out from your diet and do what I'm going to say in the next slide. And do it for 2 weeks, really, really strictly. So 2 weeks only. And let me know if you don't have any slight improvement in your reflux, and I'll be surprised, because I've had clients who have been on reflux medication for years and it's been very severe. They've made these little changes to their diet and they've been able to reduce their reflux. And one of my clients who was on PPIs for 10 years, every single day for 10 years, he can now have, he only needs them when he has a glass of wine or a carbohydrate at night, which is what I'll talk about now, actually. So timing is everything. Nighttime is when you need to think about what you eat. At night, don't eat a big meal. Have your smallest meal at night, but really importantly, don't have carbohydrates at night. So your rice, your pasta, even your potatoes, none of that at nighttime. And this is only if you have reflux and you want to improve your reflux. So I'm not saying go no carb forever, but eat your carbohydrates for breakfast and for lunch. And at nighttime, have no carbs on your plate. So you'll eat vegetables and you will eat meat. In terms of vegetables, you won't have tomatoes or peppers. You won't have any citrus fruit. You won't have any spices or chili, nothing like that. And no carbs. So your plate is really simple: vegetables, salads, and a nice protein. The other thing I should have mentioned in the last slide as well is be very careful of the types of oils and fats you eat. With reflux, fats like your canola oil, your sunflower oil, deep fried foods, those are really aggravating to reflux as well. So rather go with olive oil, coconut oil, avocado oil instead. Okay, so timing is everything. I'm jumping around a bit, I'm sorry. Next time I'll have some notes. But timing is everything. At nighttime, no carbohydrates at night. And the second thing, so rule number 1, no carbs at night. Rule number 2 is eat at least 3 to 4 hours before bedtime. I know this is really hard. But if you think about what happens with reflux is when you're standing upright and you've got a full tummy, gravity keeps the contents of your stomach down, and you tend not to struggle too much with reflux. If you lie down and you've got a full tummy and you've got a problem with that little sphincter muscle, or you've got a hiatal hernia, or you're overweight, or you're pregnant and you've got a lot of intra-abdominal pressure, everything's pushing upwards, If you're taking a medication that is aggravating your digestive system, if you, so basically if you are prone to reflux and you lie down and you've got a flat tummy, and this is your tummy full, and the contents of that stomach are just going to seep through into your esophagus and really make you feel horrible. So eat 3 to 4 hours before lying down. And by that time, your digestion should have really set in and your stomach won't be so full. So have a small meal, no carbohydrates, eat 3 to 4 hours before lying down. And that is difficult for people, especially if they've got work full time, if they've got families, but just move. You've got to do it. It's one of those things you've got to do if you want an improvement. And any other tips? Okay, so this little kitty cat here. This is also quite uncomfortable for people, but if the reflux is really bothering you, especially at night and first thing in the morning, sleep with some cushions behind some extra pillows. So I recommend to clients 3 to 4 pillows. So 3 is probably best. Sleep with 3 pillows. Some people actually even end up sleeping upright because that can really help. Again, it's not nice, but you'll get used to it and you'll feel a lot more comfortable. So you just don't want to be completely prone like that. You want to be sort of just at a little bit of an angle so things can't come up. That makes sense. If you're overweight or if you're smoking, you really do need to stop smoking, and you need to lose weight. I know that's easier said than done. That is something I can help you with in terms of weight loss. If you need to lose some weight, please do book a consultation with me and I can help you with that. And also just chat, if you are on medication, chat to your doctor, see if there's an alternative, see if you can change the dose. If there's no alternative, if they can't change the dose, come and see me and we can give you a remedy that will work with your medication, won't interfere, and it can help with the side effects. So that's it. That's me. I love to try and educate my clients. I think if you know what's going on in your body, you'll always be able to cope with it a lot better. So please, if you haven't already signed up for my newsletter, I do send out a weekly newsletter. I keep it short. I just give you tips on what you can do at home. If you do need a homeopath, please come and see me as well. And you can book online. I see people online, and I also see people at my clinic in Netherlands as well if you're in Perth. Right. I'm just going to have a look at the chat now. Please, I'll just move this so you can read my quote from one of my clients. Are there any questions? Please just put in the chat. There was a question earlier. Let's just read it. Oh, Marge. Yes, hi. Okay, so Marge asks about how I mentioned earlier the difference between problem swallowing and pain on swallowing. If you experience pain, burning, tenderness when swallowing, then that could be more reflux. But do go to your doctor and get this checked out. If you're struggling to swallow, and some people do this, especially when they eat, or some people even when they drink water, they actually can't get it down. You do need to have that checked out. There's a variety of different things that can cause that, but generally that's not reflux. With reflux, you can still swallow fine. It's just really uncomfortable. But if you're having problems actually physically swallowing and getting food or water down, please go to your GP and get that checked out. There's a number of different things that can cause that. Are there any other questions? Just have a look. Any other questions? How long do you have to do all this stuff for? you know, everything I share with my clients is, I try and share small tips that you can change long term. So I say, I don't know how to answer this question. Basically, if you have severe reflux, and it's a problem, you need to get it sorted out. So you need to make these changes and stick with them until you're better. Once your reflux is better, our bodies heal themselves beautifully. It's incredible how quickly we can heal if we give our bodies a chance. Once your reflux is gone, then you can start reintroducing tomatoes. Some people find that raw tomatoes are fine, but cooked tomatoes are really bad. So if you eat something like bolognese, a spaghetti bolognese for dinner, that would just be terrible for a lot of people with reflux. It's the pasta, and it's also the tinned tomato. So once your reflux is under control, hopefully gone away, then slowly introduce one thing at a time. Introduce tomatoes. If there's no aggravation, if you feel fine, introduce peppers. If you feel fine on those, introduce citrus fruit. So it's up to you. Everybody's body is different. And if there's one thing I've learned in life, I've been working in health for nearly 22 years now. We're all different, and there's no one diet for everyone. So even the stuff I'm saying to you tonight, you need to listen to your body, and you need to find out what aggravates you the most. Maybe it's chocolate. Maybe you're lucky and you're fine on chocolate. Then don't cut it out if you're fine. But find what aggravates you. Maybe for you it is citrus fruit. Maybe it's fruit juice. That's another thing I should have mentioned. It's not just citrus fruit that can aggravate reflux. Fruit juice can. Fruit juice is known specifically to aggravate stomach ulcers, but it can also really aggravate reflux. So find out, listen to your body, even if you have to keep a little diary, a little note of what you eat for a couple of days, and when you are worst, what is causing you the most reflux. Whatever it is, cut it out until you are better. Stop inflaming your body, stop causing the problem. And I hope that's answered your question. So it's not forever, it's until you're better. Alrighty, no more questions. Again, I'm sorry about tonight. For those of you who are listening tomorrow, I apologize for the mess up. I'm learning technology bit by bit, and it doesn't always work for me. But thanks for joining, and keep well. I try and do a free webinar on a different health topic every single month. So join my newsletter, and I'll let you know when I'm doing my next webinar. If you have any topics you would love me to discuss, please either send me a message, go onto my website, ruthhull.com, and just send me a message on the contacts page of what you'd like to learn more about. And or go onto my Facebook group as well. It's at Ruth Hull Natural Therapies. Thank you. Good night.